For the last poster presentation entitled Exploring the Impact of Cross-Tapered Near-Peer Teaching on Medical Students Transitioning into Clinical Medicine, presented by Omar ElDeeb from Newcastle University, Medicine, Malaysia.
Okay, thank you. So hello everyone, my name is Omar. I'm a fifth-year medical student at Newcastle University, Medicine, Malaysia, and I'm excited to present our study today on exploring the impact of cross-tapered near-peer teaching on medical students transitioning into clinical medicine. So we observed that across recent cohorts, third-year medical students entering their clinical clerkships faced notable challenges in transitioning from a theory-based curriculum. This was evident in their subjectively reported low confidence and objectively poor performance in the first academic exam of the year. The literature identifies various factors contributing to these difficulties, but at our institution, we hypothesized that the abrupt shift to a self-directed learning model in a clinical medicine was a primary factor driving the students' insecurity. So to address this, we developed a novel educational approach that integrates elements of proven methodologies. First, near-peer teaching, scaffolded learning, and metacognitive stimulation. So the efficacy of our program is being evaluated using a prospective cohort study design. Participants in the intervention group, so those attending our program, are compared to non-attendees based on self-reported confidence measured via Likert scales and performance on a 60-item MCQ examination reviewed by our senior faculty members. Currently, in its pilot phase, the study aims to assess how this program impacts the confidence and academic performance of the students transitioning into their clinical clerkships. The program was conceptualized, organized, and delivered by our team of final year medical students who underwent training in the near-peer teaching model. It primarily targets the third-year medical students and is facilitated by final and fourth-year medical students, maintaining an evidence-based facilitators to student ratio of 1:4. So our educational framework incorporates scaffolding at both a micro and a macro level. At the micro level, sessions progress from a didactic teaching to an interactive discussion between students during MCQs, followed by clinical workshops where skills are demonstrated and students practice clerkship simulated cases with personalized feedbacks from their near-peer teachers. In addition to that, optional homework assignments are provided to reinforce the learning and prepare students for subsequent sessions following an I do, we do, you do approach. At the macro level, the program's intensity is higher at the beginning of the semester, with sessions gradually spaced out to foster independent learning. The content also evolves to become more practical as the program advances, culminating in a final MCQ session involving both the intervention and our comparator groups. Furthermore, we believe that this near-peer teaching program is the first of its kind to implement this metacognitive stimulating approach, where we try our best to teach the students how to think rather than what to think. So preliminary results show encouraging outcomes, particularly in the self-reported confidence by the students. Significant improvements have been observed after individual sessions and as the program progressed as well. We are optimistic that the further analysis of our MCQ mini tests and the results will support the overall efficacy of this approach. Ultimately, we aim to share our complete findings along with a replicable resource that can facilitate the implementation of this model in other medical institutions and on a wider scale. Thank you.
Hi, Omar. Dr. Mandy Moffat here. Thank you very much for your presentation. It was really interesting. I know you're still looking at the preliminary results and you're looking at the students who received the near-peer teaching. Did you have a chance to explore the more senior students who were involved in the peer teaching and if there was any impacts on being involved in near-peer for those students as well?
So our feedback forms actually were provided for both the facilitators and the students. And interesting enough, the facilitators actually were one of the people who benefited a lot. And we were thinking of making this some sort of a subgroup analysis in our research, especially after finding this interesting finding. Yeah.
Thank you for your study. I think it's very interesting. Even though it's in just preliminary result, I wonder that it seems that your study, the near peer teaching program is quite beneficial for junior medical students that just enter clinical year. And so do you plan to have a feedback from the senior year that like a peer tutor? Is it beneficial for them also?
Yeah, so we actually send out the feedback forms to everyone, including the facilitators. And we were thinking, as I mentioned earlier, of making some sort of a subgroup analysis to see the impact of the facilitators' confidence in the topic that was being taught at that session. Yeah. Thank you.
How do you recruit the senior medical students for the junior medical student, like the method?
So mainly the methods was, so it shows the 4th and 5th years, so they can help teaching the 3rd years. And we mainly recruited them via mass email. However, the other part that is unique to our program is maintaining a standardization, some sort of standardization. So all of these facilitators who volunteered to join us, we would try to be on the same page, very clear with the learning outcomes of every session, the way the feedback should be given, and our ultimate goal from this. So to keep some sort of standardization among different groups.
Professor Susie Schofield, thank you. My own supervisor was Keith Topping, who did an awful lot of work in this area. So it's really great to see yet another innovation here in a research question. Who decides on the tapering? Is that defined by the program, or is that decided between the student and the near peer?
Okay, so the tapering, it's mainly discussed among the 5th years who are organizing this program. And then following that, it would be reviewed by a senior faculty. So mainly when we mention about tapering, it's mainly we discuss a presentation rather than a condition. So for example, shortness of breath. And then slowly across the session, we switch from us teaching them to them doing a case and them discussing it and explaining to us how will they manage it and further on. Yeah.